Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Critical Care Pain Observation Tool assesses behavioral indicators of pain in patients who are unable to self-report, such as those who are intubated or sedated. It evaluates facial expressions, body movements, muscle tension, and compliance with the ventilator or vocalization in non-intubated patients. The main purpose of the tool is to provide a reliable and valid method for healthcare professionals to detect pain in critically ill patients. This facilitates timely and appropriate pain management interventions, reducing the risk of complications related to uncontrolled pain, including hemodynamic instability and prolonged mechanical ventilation. The Critical Care Pain Observation Tool is indicated for adult patients who are unable to self-report pain, particularly those who are sedated, mechanically ventilated, or cognitively impaired. It is most useful in intensive care unit settings where pain assessment is challenging due to the patient's communication barriers. The tool has been validated for patients receiving invasive procedures, post-operative care, and those with altered levels of consciousness. It focuses on observable behavioral indicators, such as facial expression, body movements, muscle tension, and compliance with the ventilator to objectively assess pain levels. Studies have shown that it provides reliable and valid pain assessment in critically ill patients, facilitating timely and appropriate pain management interventions. The Critical Care Pain Observation Tool consists of 4 items, assessing facial expression, body movements, muscle tension, and compliance with the ventilator for intubated patients or vocalization for non-intubated patients. Each item includes specific behavioral descriptors scored on a scale from 0 to 2, where 0 indicates no pain behavior, 1 indicates moderate pain behavior, and 2 indicates severe pain behavior. The clinician observes the patient during rest and during a potentially painful procedure, scoring each item accordingly. The scores of the 4 items are summed to produce a total score ranging from 0 to 8. A total score of 0 to 2 typically suggests no or mild pain, while scores greater than 2 indicate moderate to severe pain requiring clinical intervention. Scores should be interpreted in the context of patient condition and pain management goals. Repeated assessments allow for monitoring changes in pain over time. The Critical Care Pain Observation Tool demonstrates a sensitivity ranging from 83% to 93% across multiple studies. Sensitivity refers to the tool's ability to correctly identify patients who are experiencing pain. For example, a sensitivity of 90% means that 90 out of 100 patients in pain are accurately detected using the tool. Specificity for the Critical Care Pain Observation Tool is reported between 79% and 90%. Specificity indicates the tool's capacity to correctly identify patients without pain. Thus, a specificity of 85% implies that 85 out of 100 pain-free patients are correctly classified. In clinical practice, high sensitivity reduces the risk of missing pain in non-communicative critically ill patients, while acceptable specificity limits false positive pain assessments that could lead to unnecessary interventions. The Critical Care Pain Observation Tool was developed in the early 2000s as a response to the need for an objective method to assess pain in critically ill patients unable to communicate verbally. Pain assessment criteria within the tool focus on facial expressions, body movements, muscle tension, and compliance with the ventilator or vocalization for non-intubated patients. Validation studies conducted by initial developers and subsequent researchers demonstrated strong inter-rater reliability with kappa values exceeding 0.8 and internal consistency coefficients around 0.8 to 0.9. Construct validity was supported through correlations between critical care pain observation tool scores and self-reported pain levels in communicative patients, as well as physiological indicators such as heart rate and blood pressure changes. Sensitivity and specificity analyses showed detection accuracy rates of approximately 85% to 90% when distinguishing painful from non-painful procedures. Moreover, cross-cultural validations and translations into multiple languages have confirmed the tool's applicability in diverse clinical settings. Research by Jelinas and colleagues and other independent groups consistently report that the critical care pain observation tool provides a systematic, reproducible, and clinically meaningful approach to pain assessment in adult intensive care units. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.